अस्सलाम वालेकुम। मेरी इस वीडियो का मकसद उन नौजवान डॉक्टर्स को गाइड करना है, उन यंग डॉक्टर्स की रहनुमाई करना है जो कि इस पेशे में अभी दाखिल हुआ चाहते हैं। एक्चुअली आपने सुना होगा, अगर नहीं सुना तो सुनते रहेंगे। थर्ड ईयर में जब मेडिकल कॉलेज में बंदा पहुंचता है तो एक ही बात की जाती है कि हिस्ट्री इज़ वेरी इंपॉर्टेंट, and indeed it is very important. And can you believe me that even now, when I question myself, the answer is always that history is very important. But the question is, when we start impressing about history and whatever we have read in MacLeod's or in any clinical method book, what happens is that we try to follow the same pattern. The pattern is taking history and then seeing the patient and then seeing the results and everything. But things have changed. There is a lot of awareness with this social media and everything. Now the patient is much more eager. Most of the time when the patient comes, the patient is holding so many files, so many tests, so many ultrasounds and so many blood tests. Now the patient is much more interested to show what are the tests, although those tests may be very much irrelevant to you. Similarly, the patient is much more interested to tell you the names of previous doctors and the medicines which the patient is taking. But my dear young doctor, rather than getting irritated, I think you have to change the style of seeing the patient. At least I have changed. Rather than going in that schematic way, the way we are taught in medical college, history, physical examination, and then test, I think what I do is, and which helps the patient as well as me, rather than getting irritated, that first I would get hold of all those tests and papers. I go through it, and then the patient is satisfied, and so am I, because the patient doesn't get impatient. He remains patient. The patient doesn't become irritable, and so do I don't become irritable. So with this rapport, with this good start, it is a win-win situation, both for you as well as for the patient. Now, what I am trying to say, that we should know the words which are written in Davidson, Harrison, or any other son, because all these books of medicine, they are some or the others, one son or the other son, like mentioned Harrison or Davidson. So, my dear, what we should do is that we should know the exact translation in which the patient is going to describe all those words. For instance, what I was taught, what is angina? It's a sense of impending dissolution. It's a sense as if the patient is seized with pain. No, most of the time, the patient is not going to tell like this. The patient is going to express this in the form of air or हवा कि डॉक्टर साहब मैं जिस वक्त भी 2 कदम पड़ता छाती ਦੇ ਉੱਤੇ ਗੈਸ ਚੜ ਜਾਂਦੀ ਹੈ ਔਰ ਡਾਕਟਰ ਸਾਹਿਬ ਫਿਰ ਮੈਨੂੰ ਹੋਸ਼ ਨਹੀਂ ਰਹਿੰਦੀ, ਫਿਰ ਮੈਂ ਇੱਥੇ ਦਬਾਉਂਦਾ ਉੱਥੇ ਦਬਾਉਂਦਾ ਡਿਕਾਰ ਆ ਜਾਂਦਾ, ਜਦੋਂ ਡਿਕਾਰ ਆਉਂਦਾ ਫਿਰ ਮੈਨੂੰ ਪਤਾ लगता और बाज़ औक़ात मरीज़ अज़राए जोश ख़ताबत, इवन पंजाबी में भी हवा के बारे में कुछ मुलाहज़ात बोल के कहते हैं कि जनाब इस हवा ने फ़लाँ दी फ़लाँ हवा ने मैंने तंग करके रख देता है. Now, the description of angina is altogether different, sense of impending dissolution and seizing with a pain, but the patient is trying to describe it in such a different way. Similarly, most of the time I get description of migraine not in that way that doctor I get headache and this and that. More than often the patient is going to tell me, Doctor Sahab, हवा चढ़दी है, ऐसी चढ़दी है अद्धे सिर नूं जाके नप लैंदी है, उल्टियां छुट जांदियां, अखां गा हनेरा आ जांदा है. Now see how he or she is describing so differently what we have read about migraine. So I think I plan to give a detailed system-wise analysis of how to take history and how to actually translate words of those medical teachings which we have fortunately or unfortunately studied in English but we have to be at the same frequency as the patient is. So for that matter, linguistically, culturally, we have to be very close to the patient. So wait for my next video when I'm going to not only tell about history, but also about various systems examination, because systematic examination is becoming thing of the past. I am sure that it is a beauty if you commit yourself with medicine in systematic way, the way it should be. Thank you very much.